the new leprosy? Hello and welcome to the channel. When we think of skin conditions, a lot of diseases come to mind. Literally scores of skin problems, which are well known to us. The thing about skin is it's the largest organ in the body. Did you know that? It is literally the organ that is out there in your face, the most visual part of our bodies. I have a special empathy for patients with skin problems. They wear their problems on the outside, and very often it makes for discomfort, pain, swelling, redness, and itching, none of which is socially pleasing. Skin diseases are actually quite easy to classify. They are either infectious, inflammatory, genetic, or hormonal. I have good news and bad news here. Shall I start with the good news? Whilst we don't see the serious skin infections anymore, the bad news is, at least in my experience, the inflammatory group of skin diseases is increasing in incidence and prevalence with each passing year. This does not surprise me at all, but it is indeed alarming. Inflammatory conditions are those conditions that are increasingly being associated with obesity, bad lifestyle, and increasing sugar consumption. So not only are we increasing our collective risk of heart attacks and strokes and cancers, we are also ruining our skins in the process. It's like we are not content to ruin the inside of the parcel, we are hell-bent on destroying the packaging as well. I have a patient with a severe case of an inflammatory condition that I shall discuss later in this video. She is mortified by her illness because it is truly harrowing. I feel her pain when she says, "I feel like a leper." Leprosy may be eradicated in many parts of the world, but its modern equivalent is very much with us. Let me take you on a journey into the world of skin diseases. How many of these conditions have you heard of or had yourself? Let's start with the infectious ones. Caused by pathogens like bacteria, viruses, fungi, and parasites, infectious skin diseases include viral infections like herpes simplex, warts, molluscum contagiosum, fungal infections like athlete's foot, ringworm, and candidiasis, parasitic infections like scabies and lice infestations. Bacterial infections include cellulitis, impetigo, folliculitis, and leprosy. Let's talk about leprosy. Leprosy, also known as Hansen's disease, is a chronic infectious disease caused by the bacterium Mycobacterium leprae, a slow-growing bacterium that primarily affects the skin, peripheral nerves, upper respiratory tract, and eyes. Historically, leprosy has been one of the most stigmatized diseases, leading to significant social exclusion and misunderstanding. Although effective treatments exist today, leprosy continues to affect thousands globally, particularly in regions with limited healthcare access. Leprosy is caused by Mycobacterium leprae, which is transmitted primarily through prolonged close contact with an infected person. The bacteria spread via droplets from the nose and mouth of an untreated individual, although it is much less contagious than other airborne infections like tuberculosis. The good news is only a minority of people exposed to the bacterium develop the disease. Leprosy symptoms develop gradually often years after the initial infection, due to the bacterium's slow growth rate. Symptoms can vary depending on the type and severity of the disease, but generally include skin lesions. Patches of skin may lose color and sensation, appearing lighter than the surrounding areas. These patches are typically painless. Nerve damage. Peripheral nerves can become enlarged and damaged, leading to numbness and muscle weakness in affected areas. This nerve damage can result in a loss of sensation, making individuals susceptible to injuries and burns. Eye problems. If the facial nerves are affected, leprosy can impair blinking, leading to dryness, injury, and potentially blindness. Deformities. Untreated leprosy can result in deformities, particularly of the hands and feet and face. Muscle weaknesses and repeated injuries can lead to clawed hands or foot drop, and in the face, the lumps and bumps and deformities lead to a characteristic lion-like facial appearance. A picture is shown here. There are three main types of leprosy. There is the tuberculoid type, which is actually a milder form with limited skin lesions and less severe nerve involvement. The lepromatous leprosy type, which is more severe with widespread lesions and extensive nerve damage, and borderline, which is a mixture of the two. Hormonal skin problems. Well, there are two main ones. The first one is often associated with pregnancy, and it's called melasma. This is a dark discoloration or areas of patches on the skin, commonly on the face, and it's usually, as I said, associated with pregnancy or also skin exposure to sunlight. Acne. Most of us have encountered acne to some degree or other growing up. Yes, the ultimate hormonal skin problem, specifically the hormones of puberty. Acne occurs when hair follicles become clogged with oil and dead skin cells, resulting in whiteheads, blackheads, and pimples. This common skin condition primarily affects adolescents, but it can persist into adulthood. Genetic skin conditions. These are quite exotic, quite rare, but they do deserve mention here because occasionally we do see them and it's nice to be able to recognize them. The first is called ichthyosis, and this is a group of disorders actually, not just one disease, and they cause dry, scaly skin due to abnormal shedding. It kind of looks a little bit like snake skin. Quite unfortunate, and people who suffer from this are really, in the end, quite isolated in their social life. They turn into hermits because it's quite unpleasant, this condition. It's not a very pretty sight, unfortunately. Epidermolysis bullosa is a condition that leads to fragile skin that easily blisters and tears. And the risk of infection is high because if the skin is not intact, there is every chance that a bacterium or a virus or a fungus can get into it and cause damage. It's another one that's quite difficult to suffer from. It's, again, not a very pleasant one to have. Albinism, this is a lack of melanin in skin, in dark skin, dark genetic skin, which results in a very light skin or even white skin. Now, albinism is actually not that uncommon in African and South American populations. It is, however, a very stigmatizing condition, and often children, especially with albinism, are mocked, bullied, and targeted. There is, like with all classes of lighter skin, an increased risk of skin cancer, of course, with albinism. So skin protection is very much part of the strategy involved in managing it. Inflammatory skin conditions, these result from immune system dysfunction or allergic type reactions. Examples include eczema, which we all know, or at least most of us know about. Eczema is otherwise known as atopic dermatitis. And this is a chronic itchy rash typically seen in children but can persist into adulthood. Eczema is a chronic inflammatory skin condition that causes red patches on the skin, dry, itchy, often in response to allergens or irritants. Treatment focus is on moisturizing the skin, using topical steroids and avoiding triggers. Psoriasis, this is another common one. But did you know that psoriasis was also an autoimmune disease? The issue here is acceleration of skin cell production, leading to thick, scaly patches that appear anywhere on the body, commonly on the elbows, knees, and scalp. This condition varies in severity and can be triggered by stress, infections, or skin injuries. Treatment usually includes topical treatments, phototherapy, biologic medications to suppress the immune response. Next up is the pemphigus group of skin disorders. This is a very important group because they can lead to basically the only dermatological or skin emergency situation. Pemphigus is a group of rare autoimmune disorders characterized by blistering and erosions on the skin and mucous membranes, including the mouth, throat, eyes, and genitals. In pemphigus, the body's immune system mistakenly attacks proteins called desmogleins that help bind skin cells together, leading to fragile blisters that easily break, leaving painful, horrible sores. Pemphigus is chronic and can be life-threatening if not treated promptly. When a person with pemphigus starts to go into the pemphigus crisis, where they start to lose body water because the blisters basically cause a complete drainage of the body water, this is a very serious condition and it's a medical emergency. It's one of maybe only two such emergencies in the specialty of dermatology. There are many types of pemphigus. The most common one is called pemphigus vulgaris. Here the blisters are soft and fragile. They may often form at the mouth first and then spread to the skin and even the genitals. They are frequently painful but not itchy, and they're usually quite superficial. And then you have pemphigus foliaceus, which is a less severe type. Again, it may form on the scalp and face first and then spread to the chest and back. It doesn't occur in the mouth. These blisters are not usually painful, and they're also superficial, and they easily form crusts. And we have next up pemphigus vegetans. This type results in thicker sores, mainly in the groin area and under the arms. There is a type called IgA pemphigus. This type is caused by the IgA antibody binding to epidermal cell proteins, again very superficial cell proteins in the skin. It may resemble pemphigus foliaceus or may appear as small pustules. And then we have paraneoplastic pemphigus. This form of pemphigus is associated with certain forms of cancer. Blisters can form inside the mouth. It may also affect the lungs, leading to a fatal outcome, unfortunately. Sores of the mouth, lips, and esophagus are almost always present, and skin lesions of different types can occur. The treatment of this type of pemphigus is basically to treat the original cancer that it is associated with. There is another type of pemphigus called the mucous membrane pemphigoid, which affects the eyes, mouth, and throat. A clinical form called the ocular cicatricial pemphigoid can result in blindness if it involves the eyes, and respiratory compromise if it involves the upper, deeper parts of the throat. Bullous pemphigoid is frequently limited to the skin, with blisters presenting predominantly on the tummy area, the abdomen, groin, back, arms, and legs. The blisters here can be very, very itchy and extremely painful. Gestational pemphigoid is a type of pemphigoid that often occurs typically in the second or third trimester of pregnancy. Epidermolysis bullosa acquisita is a type of a blistering pemphigoid or pemphigus rash on the skin and or around the mucosal surfaces, like in the mouth or in the groin area as well. Blisters are usually smaller than in pemphigoid. Rosacea. Now, I think rosacea is common enough. It's a chronic inflammatory skin condition that most of us may have heard about. It's not the most common, but it's quite characteristic in that you get facial redness, visible blood vessels, especially around the nose area and the cheeks, with pimples. It mainly affects adults and can be triggered by sun exposure, alcohol, even spicy foods, and stress. Vitiligo is a disorder where melanocytes, the cells responsible for skin pigment, are destroyed, leading to patches of depigmented skin, lighter skin. It's kind of like albinism, which is not complete. It's an autoimmune condition that can affect any part of the body and is often more noticeable in individuals with darker skin. Now, a famous sufferer of vitiligo was, of course, Michael Jackson. Treatments include topical steroids, light therapy, and in some cases, skin grafts to restore pigmentation. Hidradenitis suppurativa. This is the illness I referred to previously on the earlier part of this video. To have it is to feel like a leper in biblical times. Hidradenitis suppurativa, or HS, is a chronic inflammatory skin disease characterized by recurrent painful nodules, abscesses, and sinus tracts, primarily affecting areas of the body rich in apocrine sweat glands, such as the armpits, groin, buttock area, and under the breasts. It is often underdiagnosed and misdiagnosed even due to its similarity to other skin conditions like boils or folliculitis. HS can cause significant physical discomfort and emotional stress, negatively impacting the quality of life of those affected. Despite being a relatively common condition, its cause is purely speculative and very, very poorly understood. And the condition is often challenging to manage as well. HS affects approximately 1 to 4% of the population, though this number may be an underestimate. It's more common in women than in men, with a female-to-male ratio of 3 to 1. The disease typically begins after puberty, with most cases developing between the ages of 20 and 40. It's very rare in children and the elderly, and is notably associated with obesity, smoking, and metabolic syndrome, which is a combination of heart disease, peripheral vascular disease, obesity, diabetes, sleep apnea syndrome. HS also shows a familial tendency, with up to 40% of patients reporting a family history. So somebody in the family already having a similar or identical condition to it. As I've already alluded to, HS presents with painful deep-seated nodules and abscesses that often occur in the same locations. These lesions can rupture, disrupting the skin and discharging foul-smelling pus and forming sinus tracts, little tunnels beneath the skin, and also scarring. The most commonly affected areas include the armpits, the groin, the buttocks, and the areas underneath the breast. These are the areas that are most often fat-containing. The disease is typically classified into 3 stages. Stage 1 is where there are just single or multiple but isolated abscesses without sinus tracts or scarring. Stage 2 is where there are recurrent abscesses with the formation of sinus tracts and scarring. The lesions are separated by normal skin. By the time you get to stage 3, you have diffuse involvement with multiple interconnected sinus tracts and abscesses, leading to extensive scarring and disfigurement. This condition leads to social isolation, as you can well imagine, depression, anxiety. It can also be associated with other illnesses like the inflammatory bowel diseases, Crohn's disease, ulcerative colitis. I've talked about these diseases in a previous video. It can be associated with arthritis, polycystic ovary syndrome, and obviously the metabolic syndrome. And all of these have obesity at their center. The exact cause is unknown, but there is a mixture of genetic, environmental, and immunological factors involved. One of the proposed mechanisms is the dysregulation of the innate immune system, leading to an abnormal inflammatory response with elevated levels of pro-inflammatory hormone messengers or cytokines like tumor necrosis factor alpha, TNF alpha, interleukin 1 and interleukin 17. All have been observed in the skin of HS patients. How do we treat HS? Well, the most important step is the lifestyle modification step: losing weight, stopping smoking. There are many topical and oral antibiotics that can be used. One of those is called clindamycin. Another is tetracycline. These are very good antibiotics that also help to reduce the inflammation. Hormonal therapy is quite important, especially in women who have this condition. So various hormones, like as in the pill, the oral contraceptive, also another medication which is hormonal based called spironolactone, all can help regulate the hormones involved and to reduce disease flare-ups. Biological therapies for moderate to severe cases, stages 2 and 3, are also quite helpful. We've talked about the interleukins, which are the cytokines, immune messengers that cause havoc and the chaotic situation within the immune system. There are certain medications which are designed to dampen these immune responses, and a lot of these medications are still being manufactured as we speak. A lot of new therapies are coming on the market every year. This is a fast-growing aspect or field of medicine with a lot of new, exciting new arrivals coming on the market. So watch this space. Surgical treatment in cases where medical therapy, so with topical steroids or medications, are not working, or is insufficient, where there is extensive scarring and sinus tract formation, surgical intervention is the only choice in these cases. And the surgical options include incision and drainage, basically cutting open the abscess areas, draining it all out, cleaning it up, and de-roofing of these tunnels that are formed under the skin, and wide excision of the affected areas, so that the patient actually comes out of surgery with a lot of areas of their skin exposed, where we leave them to heal by what is known as secondary intention. It's a special form of surgical healing. Surgical treatment can provide significant relief for patients with severe disease. But unfortunately, even with surgery, the disease can always come back. It's a horrible disease. There are many diseases that we don't hear of these days because they are more or less eradicated. Smallpox is a good example. But occasionally, the disease makes a comeback. TB was thought to be an eradicated illness, but it's making a comeback. Already in the last 10 years or so, in developed countries, not only the developing countries. Sometimes a disease appears which is not identical to its predecessor, but it's very similar enough that it evokes the same kind of emotions or associations as the original disease. I think HS is one such disease which will be with us for the foreseeable and evokes the same emotions or similar emotions that leprosy did. Do you know someone with HS, or do you have it yourself? If so, how do you or they cope with it? How do you cope with the medication, the treatment? It's all about skin today. Let me know your thoughts on skin, or if you prefer, any other medical issue for that matter. Tell all, ask all, Askadoc.